So Scott says to me, well, the lidocaine is acidic. It could actually kill the exosome. I go, that's a good point. But we don't want to cause pain. So he said, well, try it. Try it at 0.25. See if it hurts. So I just screwed on the cartridge, the disposable single-use sterile cartridge, and you can see perhaps the pins coming up. That's 2.5 millimeters. That's max. So that hurts, and you need the BLT. We said try it, and for the last, 6 or 7 procedures, I haven't been doing 2.5. I mean, I'll do it if it's a thick part of the face, meaning the cheeks, the chin. But if you just go 0.25, it's barely felt. It's like a cat licking you, and you'll see it's not painful. So that's the goal. Just break the surface, like the surface of a creme brulee, and then paint in the exosomes. You're good to go. Don't need the BLT. I think it's probably my preferred method now.
Hey there. Welcome to the Recharge Biomedical Podcast. I'm Dr. Edward Park, and if you're curious about regenerative medicine, you've come to the right place. We're diving into the latest breakthroughs in telomerase activation, stem cell exosomes, and all the cutting-edge science that's shaping the future of healing and longevity. Let's get started.
Hi, everybody. This is Dr. Ed Park, the host of Recharge Biomedical Podcast. And in this episode, we're going to be talking about facial rejuvenation. And we have a very special guest, Kathleen Seymour. And to my left or right, you can see Kathleen had a spider bite a month ago. And boy, she was hospitalized for a week. They gave her IV antibiotics. It was actually a lot worse than what you're seeing there. She was bit 6 weeks ago. I met her 4 weeks ago at Bob's house. Bob Johnson is the guy I wrote about with the neuropathy, and he's had some improvement with the injections in his nerves and his spine. So he and his lovely wife, Kathy, were like, oh my God, my sister got bit. Can you help her? So she came over the next morning, and this was her face. Those aren't whiskers. That's just gauze from what she was wearing. And then we treated her, and it got pretty much better pretty quickly. So let's look at the next slide. Kathleen is on. So she's a 75-year-old woman, a gardener. She went to bed, and she woke up with a pain in her face on August 20th, this was. And so that's what we did. We gave her a shot, just 1 milliliter of Luxear around the periphery. And 2 days later, you can see it's already less inflamed, less red, closing up. 6 days, she was very dutiful about sending me these pictures. 11 days, and then 30 days. That was yesterday she sent me that, which is amazing. So Kathleen, you're on the line. Tell us about your journey, the first week of the spider bite. What was that like?
Well, I didn't get treated right away because I thought it would go away. I didn't realize that it blow up the way it did. But a week later, my head was twice the size of my face.
I saw it. Yeah, your face was so swollen. It was really quite alarming. So they hospitalized you. They gave you antibiotics. Did they give you steroids or not really?
No, they gave me heavy antibiotics.
Yeah, I mean, because they didn't know what to do. But yeah, your face was big like a pumpkin. And so they presumed it was either a black widow, but probably a brown recluse.
Well, they didn't know, and they didn't speculate. But I think it was a brown recluse because I looked it up, and when they bite you, it did the same thing that happened to me, which was the dead tissue.
Oh, yeah, your face was necrotic. So if you look up the articles, this can take months to heal, and sometimes it doesn't heal. They have to do a skin graft. But as of yesterday, to my left, you can see it's almost normal, isn't it?
It is almost normal. And in fact, my ENT told me that the hardness that I was experiencing in my face, which went all over, up into my face by my cheekbone and back by the hinge of my jaw, he said it would last for months.
Months. And so we call that induration when the skin is hard. Is it softening up now? I know you had, we sent you 3 more vials and you just finished injecting. So every week you've had one more, just a tiny 1 ml of Luxear. Is it still hard for you?
No, in fact, it's softening up quite nicely. And I told you the other day that it was hard around the final place where it's healing. and it's softening up from there.
That's extraordinary. Well, I'm so glad. It's so great that Bob is your brother and he was able to refer you. And I'm happy you don't need skin grafts and that you can go out and everything looks great. So thank you for letting us try that.
I was terrified because they told me that they would have to clean it out or something, and they didn't.
Yeah. Amazing. All right. Well, thank you so much. It was great seeing you. I'm so happy for you. So, yeah, that's a pretty cool story. So let's talk about aging. So, she had necrosis of her face from a spider bite, and then presumably we think this could have helped accelerate it. Why? Well, here's me 25 years ago. I was very heavy. I had fatty liver, hypertension, gray hair, reading glasses. And over the last 25 years, I've been able to slow down the aging, I believe. That's explained in my books, Telomere Time Bombs, The Telomere Miracle for Hay House, and The Exosomes, Songs of Healing. So what is a telomere? A telomere is the end of a chromosome, and every time a cell divides, the chromosome shortens, and that leads to stem cell mutation and death and depletion. How do we know this? Well, this young lady with premature aging, if you look at keratosis congenita, it's a glitch in one of three things, either the TERT, the Turk, or the dyskerrin above me, hence dyskeratosis congenita. And if you have a genetic problem with that, you age very fast, you die in your teens, and you have wrinkles and gray hair and everything. And the diagram to my left shows why that is. It's implicated in all forms of disease. So I like to say there's only one disease with many faces. Speaking of faces, if you stay till the end, I'm going to microneedle myself with these exosomes. So people obviously love to look young. There's Botox, there's fillers. The gold standard is to my left, a rhytidectomy or facelift. They do an incision and they tighten it up. And of course, if you live well and long enough, you're going to get wrinkles. That's just par for the course. In the old days, I would do laser. There's different kinds of lasers, ND, YAG, and they target different things. CO2 is great, but erbium was even better for being a gentle kind of laser. And then there's ones that are attracted to other chromophores that can get rid of pigmented lesions, etc. One case I had was this remarkable RS. He came in with two of his friends, 48-year-old Hungarian dude, severe food intolerance, couldn't eat anything with processed foods, gluten, dairy, but he loved his Taco Bell. And so he had this irritable bowel syndrome, fatigue, decreased libido, erectile dysfunction, exercise intolerance, spider veins on his legs, eczema on his hands, swelling of his face. And he was very diligent about documenting his changes over 2 to 3 weeks. And basically, the spider veins on his legs went away. It was very amazing. Yeah, eczema on his hands went away. His ability to eat Taco Bell came right back. And everything was great. He eats junk food and dairy products. It's probably not the best thing, but the most remarkable case. And you could see on his face, these look totally fake, but it's not. In 2 weeks, he became, less inflamed and less angry. So why is that? Because when he ate, the food particles went through the tiny gap junctions that are supposed to be tight. And so he had Taco Bell in his bloodstream and it was causing inflammation. Kim Kardashian, about 15 years ago, introduced the world to PRP, so-called vampire facials. This is her. Hopefully this is not me in 12 minutes when I do myself, but she's bleeding and that's normal. Don't be alarmed. But when you put the PRP, which is that middle fraction in the middle, it's platelet-rich plasma, and you paint that on or drip that in, it causes inflammation. And this is true of any indication that we use exosomes for, right? So if you sprain your ankle or get a paper cut, you're going to inflammation, your stem cells are going to come and they're going to secrete exosomes to decrease inflammation and try and regenerate. So the thought is you do the microneedling, you put the PRP in, it causes inflammation, your stem cells come in and your stem cells release exosomes and the process of regeneration and healing starts. The FDA has authorized microneedling for the treatment of facial acne scars, wrinkles, and we do that, but in the old days, you had the PRP and you look really red for 4 or 5 days. We don't have that anymore. In fact, if you do microneedling with the anti-inflammatory exosomes, oftentimes you might look a little pink the next day. Sure, you might heal in 3 days, or flake, but it's really a same day thing. People can't tell you had anything done in general. So that's really benefit of using exosomes. So we don't need the stem cells. We don't need the inflammation, no PRP, no stem cells, just the exosomes. And indeed, the South Korean company that gets exosomes from heavy Korean guys like me getting liposuction, it's called Benev, and they are an $8 billion company worldwide. I gave lectures earlier in the year in Cancun. I met a great, brilliant guy. And he said, hey, doc, or buddy, why are you doing the BLT? BLT is benzocaine, lidocaine, tetracaine. Usually it can be compounded as 20% benzocaine, 8% lido, 8% tetracaine. As this lady above me is having that applied, you can put saran wrap, occlusive dressing to make it absorb faster and better. 20 to 30 minutes is usually recommended. If you keep it on for longer than 30, I could tell you get like a headache. It starts to be systemically absorbed. It's unpleasant, a little brain fog. There's two forms. There's one that has preservatives and is stable at room temperature, and there's one that's refrigerated. And again, ideally, it's about 25 minutes. Be careful not to get it in your eyes and your mouth. So why do we do microneedling? So Dr. Scott, who appeared in one of my podcasts early on, he said to me, how deep is the stratum corneum? And I said to him, I'm not sure. I think it's like this. He goes, yeah, 0.2 to 0.25 millimeters. So the stratum corneum is this thick, dead layer on the top of your epidermis. So if you're trying to get the exosomes in, which are 100 nanometers and invisible, rightly, they could probably get into the water channels, but why waste it? So what do? We punch the greens, like we make holes. You see on my top left, you see what it looks like when you aerate greens. And that's so you can make holes and let the roots thrive and decrease the problems with water circulation. Analogous thing is when we do microneedling. So in the past, I used to microneedle to the max depth, max damage, max aeration, 2.5 millimeters. So if you look on this device, there's a dial and you could see the pins coming out. Maybe you can see, maybe you can't. I will try to show you. So Scott says to me, well, the lidocaine is acidic. It could actually kill the exosome. I go, that's a good point. But we don't want to cause pain. So he said, well, try it. Try it at 0.25. See if it hurts. So I just screwed on the cartridge, the disposable single-use sterile cartridge, and you can see perhaps the pins coming up. That's 2.5 millimeters. That's max. So that hurts, and you need the BLT. But he said, try it. And for the last, 6 or 7 procedures, I haven't been doing 2.5. I'll do it if it's a thick part of the face, meaning the cheeks, the chin. But if you just go 0.25, it's barely felt. It's like a cat licking you, and you'll see it's not painful. So that's the goal. Just break the surface, like the surface of a creme brulee, and then paint in the exosomes. You're good to go. Don't need the BLT. I think it's probably my preferred method now. So there's one FDA-approved microneedling device. They spent a lot of money, so likely they have the rights. But Dr. Penn, I presume, is a Chinese company, and it makes a good product. They're on their 11th or probably 9th iteration. But I like the 8S. It's portable. You don't have to keep it plugged in, and it keeps a good charge. And at this time, I prefer the 18-pin setup. Variable speed. Oh, this is error. It's not wired anymore. It's wireless, and it's about $2 a cartridge. So the tools I brought for you are a sterile urine cup. Of course, it's just a sterile cup. And it's a cosmetic brush. My friend Jessica taught me this. It's very soothing as you paint it in. It's not technically sterile. What do we do to clean? Dr. Scott uses witch hazel. I'll use betadine, air dry, and then wipe it off with sterile saline. So once I get the sterile gloves on, everything is sterile. So let's talk about it. And if you go to these shows, these cosmetic shows, exosomes are these needs. Everyone's got it. Everyone claims it. And it's because it actually works. And why wouldn't it? That's how the body heals. And so if you can cause a little damage and break the surface of the creme brulee and put in the exosomes, then you're in good shape.
We age because our telomeres shorten and our stem cells deplete. But what if we could support both? I've been taking TA65 for 17 years. It's the only supplement I trust to support better mood, better sleep and exercise recovery. And at age 57, I don't have any gray hair and I don't need reading glasses. TA65 is available now. Go to rechargebiomedical.com/TA-65 and enter promo code RECHARGE10 to save 10% off.
So when I'm looking at a patient, okay, I just squeezed out this ultrasound gel, and so it's sterile. I used to use hyaluronic acid, but it tends to oxidize and get a little yellow. So they're single-use packets. So we will just kind of, after we sterilize the face, either with witch hazel, betadine, wipe off the betadine, we will then put the gel on the face, and that helps it glide so it doesn't get stuck. So this is the way I kind of think about the face. And you have to be cognizant that when you're doing the forehead, especially in older people, it's kind of thin. So if you are doing the BLT with numbing, you might not be able to go 2.5. It'll be too painful. So the places that are painful are generally the forehead, where it's thin, the temples, and nose. There's more nerves around the mouth, but it's pretty well tolerated. So you can just dial it up and down for the depth. Again, we ask them to, with gloves, wash off the anesthetic if they've used that. If they have a strong history of herpes, cold sores, then they might want to consider prophylaxis with Valtrex. Oh, I am remiss. Let me thaw this out. It's halfway thawed since we started the webinar. This is the Vive product. It has fragrance because the sulfur-containing amino acids make it smell like eggs or bad. So I'm going to pour that into my sterile cup. The reason I said 80% thaw is because, you could 100% thaw it. But you can see here that the exosomes are in there. They're still not thawed. This is really exosomes with normal saline. And so, yeah, we're going to put some glide, or I'm going to put my sterile gloves on. And then you will see how it's going to go. So, sterile gauze. Bleeding is good. Adjust the depth. And yeah. There you go. All right. So I will go top right because I'm right dominant, the forehead. So I will make the holes, and then I'll use the gauze to wipe off that region, and then I'll paint them in. Okay. And then I will microneedle the left side with the gliding gel of the forehead. Gauze, wipe it off, paint them in. And the reason why we don't do it all the face at once is because, even in those seconds after you make the holes, the body naturally bleeds, puts fibrin, tries to seal a hole. You got the hole, use the hole, right? So then I'll work my way down to the right temple and the right cheek. The cheek is very thick usually, and you can do nasolabial folds. And so these are just the way we break it up into regions. So we'll do the right cheek and then clean off the blood and the gauze, the gel, and then paint in the right cheek, and then left cheek. And then we will do chin. If they've got enough product, they purchased enough for chin and neck, we'll do that. Chin and nose is last. And under eye, you can kind of do separately because it's very thin. It could be painful, could bleed as well. So it's pretty easy. And people do this at home, actually, to themselves with the freeze-dried products. So why is this going to work? Well, it's anti-inflammatory. It disrupts. The microneedling is punching the greens, and then the exosomes will cause the accelerated regeneration. So you can be red for a few hours. The next day, people can't really tell. Again, you can flake or peel on day 3. Anything that's inflammatory, like I used to do this with laser, if you're a Fitzpatrick 4 or up, these are the melanin content, 1 through 6. There's this thing called post-inflammatory hyperpigmentation. So you can zap someone's melasma, and then in 3 weeks, you'll start to get dark again. People say it came back. It didn't come back. The inflamed, exploded, damaged skin became inflamed, and it got new pigment. So I looked at some obscure Southeast Asian journal, and when I was doing lasers myself, I would just have them compound the moisturizer with a mild steroid or moderate steroid and bleaching cream. And even a lot of the dermatologists, I would say the vast majority, didn't know about this. So they would be loath to treat somebody with Fitzpatrick 4 like myself or darker. But I'm here to tell you that there is a way to remediate it. You don't start the steroid bleaching right away. You start in about 2 weeks, and that will abate the creation of this new post-inflammatory hyperpigmentation. So after hair transplant, we'll talk about hair transplant in this week's podcast. After laser, after skin burns. This is a patient, friend of mine's wife. who had a terrible fire. It exploded. She got second, third degree burns on her face. She got weekly IV exosomes because the inflammation made it go to the burns. And her face looked wonderful after just a week or two. So again, aging is ubiquitous and exosomes can accelerate that healing, it appears. This is my son 5 years ago. He had some pretty bad nodular cystic acne. And we started giving him treatments with exosomes, regular and amniotic based. And at 9 months, a lot of those ice pick scars abated. Finally, another poster I show in addition to Richard, the Hungarian dude with the IBS or the Taco Bell allergy. Allegra, amazing woman. Her son had a terrible gymnastics accident. His apparatus froze and the kid went around the high bar and broke his wrist and shoulder. So she rushed him in the next day from Chicago, and we did injections into a shoulder joint where there was a fracture and into his wrist. I mean, this was, a couple weeks after. And hopefully it abated some of his limb length discrepancy because he came in as like a 13-year-old and now he's 6 foot, like 17-year-old. But anyway, she had 11 children. I'm not a religious person, just liked having kids. And so she's going to get another treatment soon. We'll meet. I'm not licensed in Illinois, but we'll meet. And you could see she sent me a bunch of pictures. And, obviously it's different lighting, better makeup. But after her treatment with just 6 billion exosomes, that's one of the regular things, not the VIV, she looked great and she felt great. And I think that's a good result. Tighter, smaller pores, smoother. So yes, there is hope. All right. So, this is me at the Museum of Modern Art a few years ago. You could see I have eczema. So you could see there's a lot of dryness, flakiness on my skin. So intermittently it's coming back. I did it a couple months ago. This is an expired lot. You can see it's kind of dark and oxidized. So I don't waste the good stuff on me. But if I was really serious about looking good, then I would probably use the good stuff as Allegra did. Well, that's my Substack. If you want to join, I'd love to have you. I send out weekly announcements and private guests, 3-question interviews. We've done 24 already to date podcasts. And you can also subscribe to my YouTube channel, Dr. Park 65. Join my weekly newsletter at Recharge Biomedical. And if you're a provider and you want to learn this and all the other procedures throughout the body, there's a 20-lesson, 12-hour online course that you can purchase as well at Recharge Biomedical. All right. If someone had PRP prior to exosomes, with one affect the other? No, it's the same final common pathway. PRP, inflammation, stem cells, exosomes. So we don't need the first three. We just go to exosomes. Of course, the trauma is going to cause inflammation and your own native stem cells and exosomes. But the real secret sauce is in the exosomes, isn't it? So, question from Mark: does mixing the exosomes with normal saline or sterile water affect potency? Great question. Of course, 0.9% normal saline is isotonic, isoosmotic, so it's not going to cause those little buggers to explode. I would never use sterile water because of the osmotic factor. It will cause them to explode. Good question. All right, let's get our guinea pig ready here. I'm going to put on my sterile gloves. Just keep those questions fired away. And let's see, I got a little gel on my neck to help it glide. Okay. And then we got our little handy dandy thingamajigger, Dr. Pen 8S. So this is max depth, 2.5. You see this little spikes coming out? Maybe you don't. Yeah, you can kind of see. Now if I dial it back to 0, they're going back. And now I'm at 0 depth. So let's dial it to 0.25. And I will show you that it don't hurt. It doesn't even feel like a cat licking me. So I'm breaking just the surface layer. There's different speed and power settings. Let me go up to 0.5 because I'm not really getting my money's worth there. I'm going to dial it up. 0.5. Okay, so we're definitely through the stratum corneum. Again, not at all painful without anesthesia. I'm getting so old. All right, let's see if we can get the sadist some bleeding here. We'll go to max depth 2.5. Ooh, I can feel that. That hurts a little bit. Ooh, yeah, that hurts. So if I was going to 2.5, that is going to need some anesthesia or just a real tough person. You can see I think, bleeding coming. Maybe not. Thick skin. Anyway, I don't want to feel pain, so I'm going to go down back to 0.5. And we'll just continue. Because really, I used to sell glutathione bound to a molecule to sneak in through the water channels. Because these are so small, they'll get into the water channels, but why not increase the efficiency of delivery, right? So make holes. Really not painful at all. I mean, it's not going to help platysmal bands, but the thought is we're going to regrow collagen. The dermis can get better. It's going to help my eczema neck. And yeah, Bob's your uncle. Really doesn't hurt. So I prefer this technique. You don't have the anesthesia and all that jazz. Why bother? So this is actually expired lot. It's kind of yellow. I bought it back from a nurse friend of mine who is using exosomes, the Benev. It smells. The Vive smells because it has sulfur amino acids in there. And they cover it up with rose water fragrance. So we're going to take our cosmetic brush. It feels so nice. And we're just going to paint in. I'm actually going to paint my bits too, even though I didn't do. I'm having an eczema flare today. Because of the stress of preparing this lecture for you, I was stressed. Anyway, so any other questions I probably will do my face actually. What dedication to you viewers and doctors. I'm torturing myself live online. Okay, I hope you guys are subscribed. We've been doing some great podcasts, psychedelic assisted therapy. We've been doing mold, toxicity, autism. Amazing results some people are getting with autistic kids. So doctors, providers, they're really moving the needle, so to speak. One lady, I just delivered her a bunch of DART inhalers this morning. It's a wonderful doctor helping people. So again, this is totally not painful. It's something people can probably do themselves. So it smells, you can smell the vague sulfur and then the fragrance. So this is not something you want to be putting IV or anywhere else. But if people can afford the good stuff, then use the good stuff for the microneedling with exosomes, as Alodra did. Dr. Ilsuk knows that Benev is very popular in Korea, an $8 billion worldwide market. They take liposuction and may allegedly get exosomes, and then they lyophilize that. And you can learn about lyophilization in my podcast with Dr. Adam Bender, who's a peptide manufacturer who I also lectured with in Cancun. And Dr. Martin, who represents another exosome brand, I also interviewed in my podcast. So a lot to learn on those podcasts. We have some people who've taken the provider course. It's a great way to learn how to use exosomes. Even if you're not going to do it for your patients, you can do it for your friends and family, like I did my son. And it's all good. Again, I was patient number 1. I've done 3,200 treatments and over 650 people. And so even if you're not going to do it in your practice, do it on yourself because you want to look good, feel good, and anything gets damaged, you can fix it up real nice. Okay, I think that about does it. I am faded. And my next podcast, you can tune in and see if my neck looks any better. Oh, and I did a rosacea yesterday. I've had health improvement with rosacea as well. All right, everybody, thanks for joining. We'll see you next month on our next Ask Me Anything webinar. Again, this is Dr. Ed Park completing a webinar on facial rejuvenation. Take care. Bye-bye.
Thanks for tuning into the Recharge Biomedical Podcast. If today's episode got you thinking, you'll love my book, Exosomes Songs of Healing. It's packed with cool analogies, full-color illustrations, and all the science you'll need to understand how exosomes are changing the game in aging and regenerative medicine. You can grab it in paperback, ebook, or audiobook, whatever works for you. Now head over to www.rechargebiomedical.com to check it out. And don't forget to like and subscribe so you never miss another episode. See you next time.